Hi, my name is Casey Hood. This is my spring 2023 head-to-toe assessment for adult health. I'm going to show my surroundings. And my supplies. Okay. All right. I would first wash my hands, I would put on gloves, and I would greet my patient. I'm going to start by an overall assessment of the skin. I'll be assessing the skin throughout the exam. I'm going to be assessing the skin for edema, moisture, texture, turgor, temperature, bruises, lesions, scars, and nevi. And I'm going to start with the assessment of the head. I'm making sure the head is symmetrical, it's midline, I'm not noticing any deformities. I'm going to move on to the scalp. I'm palpating the scalp, I'm inspecting hair distribution, hair texture, hair color, looking for any masses, any tenderness, any deformities or lesions. Now I'm going to move on to the lymph nodes. I'm going to palpate the preauricular, postauricular, tonsillar, occipital, posterior cervical, anterior cervical, submandibular, submental, and supraclavicular. Now I'm going to palpate the temporal artery for tenderness. When you clench your jaw, that's testing cranial nerve number 5. Can you open and close? This is assessing TMJ for any tenderness, crepitus, or subluxation. Can you puff your cheeks, lift your eyebrows, poke your lips out? This is cranial nerve number 7. Now if you close your eyes, we're gonna do some sensations. Please let me know when you feel me touch.
Feel it, feel it, feel it, feel it.
Good. Now I'm going to move on to the ears. On the ears, I'm noting if they are symmetrical, if there's any swelling or discharge. I'm also going to palpate the pinnae and tragus for any tenderness or masses. I'm going to test cranial nerve number 8, which is the whisper test. Repeat what you hear.
1, 2, 3. ABC.
Now I'm going to do the Weber test for lateralization. Let me know if you can hear this in both ears.
Yes.
Let me know when you stop hearing this. This is the Rhine test.
Stop. Stop.
Good, and that tests that air control is greater than body control. Now I'm going to pull the ears up and back. Look inside. Pearly gray, no abnormalities. Pearly gray, no abnormalities. Moving on to the eyes, I'm looking at eyelashes and eyebrows and palpebral fissures. I'm also looking at conjunctiva and sclera. I'm noting any discoloration, any swelling, or any lesions. I'm also going to look in the eye and test the red light reflex. I'm going to start with testing cranial nerve number 2, which is peripheral vision and visual acuity. So let me know when you see my fingers.
See it. See it.
Good. And cover one eye and let me know the lowest line you can read.
LTFPH.
And the other eye.
LTFPH.
Great job. I'm going to test cranial nerve number 3, which is pupillary response to light. Look at my pen light, look at the wall, back at the pen light. That test for accommodation and convergence. Now I'm gonna test cranial nerves 3, 4, and 6, which are EOM, so please follow my pin light. Now I'm going to move on to the nose. I'm noting that the nose is midline, it's symmetrical. I am going to palpate the frontal and maxillary sinuses for tenderness or swelling. I'm going to check patency, so can you cover one nostril, breathe in and out. Great, cover the other one, breathe in and out. Good, now I'm going to test cranial nerve number 1, which is sense of smell. So close your eyes and one nostril. Let me know what you smell.
Vanilla.
Good. And other side.
Hand sanitizer.
Good. Now I'm going to move on to the mouth. I am inspecting and assessing the lips, the teeth, the tongue, underneath the tongue, the buccal mucosa, the pharynx, and the tonsils. Open your mouth and say ah. Good. That tests cranial nerves 9 and 10. That the uvula and soft palate rise on phonation. I also looked at the tonsils, which were grade 2. And cranial nerve number 12 is that the tongue is midline with no fasciculations. Moving on to the neck, I am palpating the trachea, making sure it's midline. Can you swallow? I'm palpating the thyroid gland. I'm also going to palpate the carotid artery, and I'm going to auscultate for breathe. I'm going to stand behind you and shrug your shoulders. Accessory muscle, that's cranial nerve number 11, and we're going to do some range of motion with the neck as well. Flexion, extension, hyperextension, lateral rotation, and circular motion. Good. Now I'm going to have you swing around to this side, and I'm going to do an assessment of the posterior chest. And before I start that assessment, I'm going to be looking for signs of respiratory distress, such as tripod stance, nasal flaring, use of accessory muscles, tachypnea, or cyanosis. I'm noting if there's any symmetry, or I'm noting symmetry and seeing if there's any deformities. Breathe in and out. I'm checking for symmetrical chest expansion. I'm going to start with tactile fremitus, so please say 99 every time you feel my hands.
99, 99, 99, 99, 99.
Thank you. Now I'm going to percuss. The intercostal spaces. I'm going to auscultate. Please breathe in every time you feel my stethoscope. Lateral lung field. Okay, now I'm going to assess the posterior lung fields with echophony. Please say E every time you feel my stethoscope.
E, 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 E.
Now bronchophony, please say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Now whisper pectorally. Please whisper 1, 2, 3. Thank you. Can you swing back around to the front? And for the anterior chest, I'm doing the same thing. Breathe in and out. I'm noting this symmetrical chest expansion, looking for any deformities, making sure he's symmetrical. I'm gonna do tactile fremitus as well. Say 99.
99, 99, 99, 99, 99.
Okay. I'm gonna breathe one more time. Every time you hear my stethoscope, feel my stethoscope. Okay, now I'm going to move on to the heart. I'm going to start with auscultation and the aortic, and that is on the right second intercostal space. And pulmonic is the right second intercostal space. Herb's point is the third intercostal space on the right. Tricuspid is the fourth. And mitral is the fifth. And that's also the point of maximum index, and that's where I would stop and listen to the heart rate. I'm going to listen with the bell in those same spots. You could lay down for me. I'm going to notice any heaves or lifts, any deformities. I'm making sure he's symmetrical as well. Can you turn your head to the right? Check for JVD, but the head of the bed would be elevated 30 to 45 degrees if we had one. Now I'm going to move on to the abdomen. I'm noting if there's any distension or any masses or lesions on the skin. I'm going to start by auscultating the arteries, aortic, renal, iliac, femoral, now I'm going to auscultate starting in the right lower quadrant, go around to the abdomen, now I'm going to percuss in that same order and palpate for the liver and the spleen. Okay, you can sit up. Do you have any CBA tenderness here?
No.
Okay, you can swing around back to the front. We're going to move on to musculoskeletal. So with musculoskeletal, I'm going to be assessing the fingers, wrists, elbows, and shoulders. I'm also noting any lesions or scars or swelling there as well. I'm going to palpate for that. I'm checking capillary refill and radial pulse. Good. Okay, we're going to start with cerebellar coordination using fast, rapid movements. So this is finger opposition and hand flip and finger to finger. So put your nose to my finger. Great. Now close your eyes and we're going to do some sensations. Let me know if it is soft or dull, sharp or dull.
Sharp, dull, sharp, dull, sharp, dull, sharp, dull.
Good. I'm going to assess your vibratory response in your medial-malleus. Can you feel this?
Yes. Yes.
And ulnar.
Yes. Yes.
Good. Okay, now I'm going to have you close your eyes and we're going to do stereogenesis. I'm going to place an item in your hand and you let me know what it is.
A dime.
Yes. And the other hand.
A spoon.
Yes. Keep your eyes closed for graphesis and open your hand. I'm going to write a number. Tell me what it is.
5.
And a letter.
C.
Good. Okay, now you can open your eyes. We're going to do some range of motion. So starting with the fingers, flexion, extension, hyperextension, adduction, abduction, thumb opposition, and in the wrist, flexion, extension, flexion, extension, hyperextension, and rotation, radial deviation, ulnar deviation, and the elbow, flexion, extension, hyperextension, shoulder, flexion, extension, hyperextension, external internal rotation, switch them, and circumvection. Good. Now I'm going to do your pressure deep tendon reflexes. So I'm going to start on the left side with your brachial radialis and the bicep and tricep, patellar, Achilles, and lift your foot up for Babinski. The other side. Patellar, Achilles, lift your foot for Babinski. I'm gonna move on to the lower body. I would assess for capillary refill in the toes and pulses. Okay, let's do the same range of motion in your fingers with your toes. So you're going to do flexion, extension, hyperextension, adduction, abduction, plantar flexion, dorsiflexion, and rotation. Great. Now I'm going to test your grip strength. Squeeze my fingers. Bicep, tricep strength. Try to pull up and push down. And pull in for shoulder strength and out. Gonna do the other side. Bicep, tricep. Push down, pull up, in and out. And the hips, push in and out. And the knee, push out, pull, try to straighten your leg. And then don't let me bend it. And other side, straight, don't let me bend. And your feet, push down like a gesso, and pull up. Good. Okay, now stand up. We're going to do some range of motion in the knee first. So, flexion on your left or right, flexion, extension, hyperextension. Other side, flexion, extension, hyperextension. Now in the hip, flexion, extension, hyperextension, internal rotation, external, adduction, abduction, rotation. Other side, flexion, extension, hyperextension, internal and external rotation, adduction, abduction, rotation. And we're going to do the spine next. So flexion is bent over, and while you're down, I'm going to be checking for kyphosis or scoliosis. Any deviation in the spine, then extension would be up, hyperextension would be all the way back, and rotation side to side. Good. Okay, now we're going to do a Bomberg test. Arms out to the front, close your eyes. That is a negative Bomberg test. Good. Come back here and walk regular. Good. Now walk to the couch, tandem walking, heel toe. Perfect. Hop on one leg, hop on the other leg. And that concludes my assessment.